There's thousands, tens of thousands of studies on pain. You can't damage someone in these studies. It's against the rules. That's against ethical guidelines. You can't damage. And so pain does not correlate well to tissue damage. And yet when we have injury, we often get pain. So what does it correlate well to? What does pain correlate well to? Healing. It is there as a protective mechanism to help us heal.
Are you curious about discovering ways of making your life better? Then welcome to my podcast. I'm Bob Nickman, and this is The Exploding Human. Listen in while I talk with all kinds of people in the fields of personal growth, health and healing, alternative therapies, psychology, spirituality, environment, and the future. I'm looking for those answers that make life better for everyone. You'll meet cutting-edge practitioners, doctors, artists, filmmakers, business people, and those who have overcome challenges. The brave, the curious, anyone who is out there helping us humans to explore, expand, and explode. Hey, welcome to The Exploding Human. My name is Bob Nickman. My guest today is Dr. Clayton Skaggs. He is a chiropractor with decades of experience. He specializes in helping people identify what they actually need to do to improve their health and overall sense of well-being, and to focus on those things and let go of everything else. It's a very simple and direct approach, which he has had great success with. Clayton has worked with World Series champions, Stanley Cup champions, elite military, PGA champions, NFL, NHL, Major League Baseball stars, as well as thousands of other professional and elite athletes. He also consults with individuals from around the world who have unresolved pain and injuries. We're going to talk about some of the things he does, particularly in how he diagnoses what the actual problem is. We also talk about the 6 pillars of resilience and how to grow stronger in your physical and emotional life. And we start off the episode talking about, of all things, juggling and how that can help. So let's jump into it. This is Clayton Skaggs. Clayton, it's great to see you again. I'm so happy you're here. Let's talk about something that was in your bio that I just mentioned to you before we started, juggling. How that is, how you incorporate that into helping people to overcome physical issues, back pain, maybe heighten their athletic abilities. What is that? What is it about juggling? I couldn't even juggle a couple of girlfriends in college.
Okay, I can't believe you don't juggle with your history. You would have done that on stage or something at some point. But
maybe, but I have very compromised vision, so I think that's
right.
An issue for me.
One of the things that we identify or have identified in our work for the past 20 years is that if you can improve someone's focus and their attention and relaxation, and bring on that parasympathetic stimulation, if you can put them into that mode, which most people now understand is the rest and digest mode of the autonomic nervous system, as we go about our days in this fast-paced world, we're often in the other mode, the sympathetic nervous system, that is the fight or flight mode. We've identified that if we can help someone get in that parasympathetic mode, they'll be able to relax and heal and perform better. And so I first started using it with our athletes, the pro athletes and different athletes that we worked with. Just had tremendous success. And now my standard comment with athletes or even other than professional athletes is, I can't believe you don't juggle. I mean, juggling is meditative, it's relaxing, it creates focus, it creates hand-eye coordination, it even grows brain cells. I mean, so even poor juggling, they did a study across about 6 to 8 weeks, and they evaluated the functional MRI of these individuals, and they showed white and gray matter growth in those that became better jugglers and even those that didn't. So it grows brain cells, and so I'm introducing it frequently. We even our everyday folks that come into the institute for pain recovery or just trying to be as fit as they can be, you'll often see them in our gym facility juggling pre-training. And then certainly if someone's trying to improve sleep or those types of things, I'm encouraging them to juggle. And it's not that hard. It's not that hard.
Yeah, I guess maybe no one ever showed me. I just sort of tried it a couple of times, and every time I dropped the ball, I'd go, I'm not doing this.
Well, that's the standard answer. I've had some really talented folks, skilled at all kinds of things, and I say, okay, here you go. There's three balls. I want you to learn to juggle. And I can't juggle. And I'm like, I said, wait, how long did you try?
Once.
Yeah, once. And I drive. And I'll send this off to you, Bob. We have a video on how to juggle. It's about a 3-minute introduction to juggling on our book website. That it's linked from the book because I talk about juggling in the book, and it talks about what the keys are to getting it going. It's all in the toss, by the way.
Oh, okay. It's like a loose toss is how I sort of always saw it. Like that's the word I would use that I think is the way to do it. I don't know. It like the whole thing has to be loose. There's a looseness to it, like a playfulness that if you don't get that, and that's true of anything. It's true of music. It's true of art. It's true of anything. If you don't have that sort of in the zone of whatever the thing is you're trying to do, which is playful at its core. That's what I think. But I know I'm better at stuff when I'm not trying too hard, in a sense. That I'm like I go after it to be in a way that's fun.
Yeah, yeah. Well, that's at the heart of the concept in the book, and the things we've done over the years at the Institute is to create that poised approach throughout your day. And if you pursue poise throughout the day, and poise is defined as, I think, a elegant and graceful bearing in a person is to be poised. I mean, if you just wrote that down and kept that in your mind, to be graceful and elegant in how you move through life, that'd probably serve you. And so we've got activities. There's 15 different things in the book that help you be more poised. So if you're more poised throughout the day, then you're going to be more poised when you get in the batter's box. You're going to be more poised when you go to bed at night, and you'll be able to relax and go to sleep better. Versus, I think often what's going on is people are running around doing things and getting stressed, and then they can't understand why when 9 or 10 o'clock comes, I can't relax and go to sleep.
Yeah. Right, they're all wound up like you overwind a clock or something. It's just. I was just thinking when you were talking, I don't know what made me think of this because I'm not even a big sports guy, but when I used to watch Pete Rose play baseball, he was like a 12-year-old kid. And I'm going, wow, this old guy, I mean, compared to a kid, he was an old man, but was having so much fun. He just didn't seem to care about the results. I mean, even though he bet on them. That's a whole other thing. But when he was playing the game and watching him, I'm like, no wonder this guy's great. He's not taking himself too seriously. He's not putting that ahead of the playfulness. And it was so fun to watch that guy. I only maybe did it 3-4 times, but it was always just hilarious to me. Like, this guy's really, he's in the zone, and it was just, and other players, they'd have, there's a certain thing that some baseball players in particular, they have this sort of cool guy attitude, like I'm unfazable. and
Mm.
I'm chewing tobacco, and I got the brim of the hat down, and I'm real serious about, and I get that. That's a technique to be taken seriously and to be imposing maybe to other players. But that watching that guy was so much fun, and he was having fun, and it was it was contagious.
Yeah, for sure. And I talk about that a little bit in the book too. The athletes that are on that even keel, that are, and sometimes they're they're childlike. I had a number of athletes I worked with that were just, real childlike in the way they approached it, which is joyful and
Yeah.
amazing. And then there were others that just kept it at about 80, 90%, and nothing really phased them. And those same individuals would often be the fastest healers because they weren't, they weren't overthinking, weren't over noticing, um, what was happening. And I think that's something that has to be developed, or often that resilience, I think, comes from early on getting through some challenges. There's
Yeah.
a lot of report of that. I've seen that, and if you look at, even some of our most recent successful folks, they had hardship early. So Mr. Jobs, Mr. Musk, and they had hardship that they worked through,
Hmm.
and and then they're a little better at resilience as they moved
Yeah,
on,
because it
to
builds
a point.
that sort of core of who you are. That untouchable part gets stronger. There's that part that
Yeah.
we have that no matter how tiny the flame gets, it's still there. And I think hardship can do that. Stress on the system, the right. Not just so you're not broken, but you just get
Mm-hmm.
stronger. And somewhere now, I think Musk might need a little more problems. He needs some more stress.
Well, that's that
That's a
that's
different podcast, but
that's another podcast, probably.
yeah.
Yeah.
Now that you've mentioned a couple times, let's say the name of the book and the website where people can
Hmm.
access it. And we'll do it again at the end.
Yeah, yeah. It's called The Power of Doing What Matters, and then the subtitle is the mind body resilience in all of us, and the website for the book is the same, powerofdoingwhatmatters.com. And the purpose of the book is to try to help others, millions hopefully, to understand that they can contribute to their resilience. And I wholly believe that, from the 25 years of working with clients and athletes and folks that have been all over the country, with pain and ailments, and they come through our doors, and we've been able to help them, uh, and it is often, uh, them, the individuals that make the difference. And I think that's a learning point for our culture. And there's some gaps there that need to be recovered in terms of, uh, giving and allowing that accountability to the patient. Um, you know, Half a century ago, I think medicine had some great things happen, and it led to some of the challenges we're dealing with today, and that antibiotics and technology came forward, and it took accountability, gradually away from the patient. It was, here, do this, and you'll be fine. And so and slowly, um, the doctor-patient relationship turned into, the doctor saying, here, do this, and you're fine. So then the patient's not really participating. So the book is part of, our understanding, things we've seen over the years, that every individual has the potential. I was just talking with a case today that we started seeing 5 or 6 years ago, 5 or 6 months ago, sorry. And gosh, she came in. She was having pain in her neck, pain down her leg. Couldn't really, exist with her family. A couple of kids.
Mm.
Couldn't have relationships with her husband because of this pain. And we did a few things. We applied some exercise and some guidance. Uh, but it was her taking on these exercises and this different line of thinking to make the transformation happen. And now she's doing great and about their thing about having another child. So it it it's just time and time again, shown us, really revealed that it's in there in every individual. There's a resilience in there that's just extraordinary.
Well, it's an interesting thing that you just said because I found this true for myself. When you say accountability, which I also see as responsibility, personal responsibility for your own healing if you have a situation. And I was just thinking my own issues that I had with my lower back a number of years ago. And so I started, and I go to the chiropractor, and I love chiropractors. I've had a lot of success there. And I know you're a chiropractor. So I think it's a great healing thing, but it would recur. And I'd be like, well, why is this? Okay, the guy fixed me. I feel better, and
Yep.
that now 6 months later, my back, goes, and I'm on my back with ice, and my knees are in the air, and it's 2 3 days, and and so I started to look at, what are the other, what can I do? The
Mhm.
chiropractor is great, but what can I do? So I started, reading books about it, Mind Over Back Pain, Overcoming Back Pain by John Sarno, which I'm sure maybe we even talked about it before, which was a really interesting sort of approach, mentally. It's to the stresses that cause these things. It's mostly not a physical uh, condition. That it's not from an injury necessarily. A lot of it was stress. And then I started to realize, well, I don't have a strong core. So I started doing Pilates. And uh, that's what actually was the thing that um, gave me a certain amount of proper alignment and core strength that I haven't had a back issue since I started doing it. And we're
Mhm.
talking decades now. And I
Yeah.
actually
Yeah.
don't even take classes. I mean, I started again recently, but I went like 15 years without classes, but I did exercises at home. So yes, I had to be accountable for what I wasn't doing, what I was doing that wasn't working. And you know what? That takes time, it takes effort, and it takes a
Mhm.
focus. And I think that's the difference in maybe everything of why people are have success at certain things. And I'm not talking about monetary success. I'm just talking about
Yeah.
anything where you can, um, you know, hit the high mark.
Yeah. 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 100%. Well, you talk about back pain being highly mental, and in truth, all conditions have mental components. There's the mind matters in all of those things. And one of the important facets that we found it really important for back pain or different types of neuromusculoskeletal problems, and it's probably relates to most conditions in even disease, is to really identify why. I mean, really identify why you're having that persistent pain, versus what it is.
Mm-hmm.
And so if we stay in this category of low back pain, so often cases come in from all over the country, and they've been told, oh, you've got a disc herniation here, uh, you've got degenerative disc disease. That's what's going on, and unfortunately, so often they've had injections, they've had rounds and rounds of physical therapy for that disc herniation. They've unfortunately of late their nerves get burned, the nerve ablation, all kinds of things, and no one's really asked, well, why? Why why is this disc degenerative and maybe producing pains? Often the disc isn't even producing the pain. And yet when we drill down on why they're in this state, then we start asking different questions, getting different answers. And most of the time it is a case of weakness. And like in your case, um, you needed some activation, you needed some movement,
Mm-hmm.
and you sounds like you just went for it. You read about not being fearful. There's no need to be fearful of this, and so you started moving. And often, if the individual is fit for the movements, then your body will gain traction and momentum and start moving forward. Uh, Sometimes, which is a lot of what happens when folks get to us, they have tried a lot of those movement strategies, and they keep stumbling. Sometimes there's some behavior in there, some fear behavior that's tripping them up, and sometimes they're doing too much. They're doing too much of the wrong exercises, and so 100, a high percent of the time we're telling people, hey, do this, this, and this, and nothing else. And frequently we're getting people better, doing less, and but importantly, nothing else, because those will take away from the benefits.
Well, that's the diagnosis I would want. Do less.
Yeah, we also we're also telling them, hey, you need to eat more. So this is what's a little ironic is so often people are a little more weighty than they want to be, or they're have a little more fat versus muscle, and so they're not eating enough. Though they're trying this diet or that diet, and we're often telling them, look, you need to eat more. You especially need to get more protein for your muscle metabolism because we're trying to recover you. We're trying to bring on more nutrients, and so typically they will eat more, exercise less, gain muscle, lose fat, and they time and time again they look at our results and are like, this doesn't make sense. And well, it does. It doesn't make sense relative to the norm for sure.
Yeah, well, what's being espoused or taught or whatever. It's
Yeah,
yeah. It's
yeah,
sometimes things are backwards. The conventional wisdom is not wisdom. It's just conventional.
yeah.
One of the things that in the John Sarno book that he said that was really helpful to me because when your back gets tweaked and it hurts, you get scared. You think, how long is this going to
Yep.
last? This is
Yep.
something. This is really. The one thing he said, which I thought was fascinating, is the pain is the pain is much worse than what's actually going on.
Hmm.
And I thought that was amazing, like, 'cause that stuff hurts, but it could only be like, what, a millimeter of off, I'm just taking a small number,
Mhm.
like a very tiny amount that it's not really that big of a deal, but it hurts and it feels like there's a big problem and maybe there's not. It's kind of like what you were just saying.
Yeah. Well, and so Sarno, he really was on the mark with a lot of his thinking, and that there's a ton of um, fear behavior out there and abnormal illness behavior related to pain, especially low back pain. And all pain goes through the brain for sure, and that often it isn't harmful. That there isn't tissue damage that is related to the pain. However, there certainly are plenty of cases where there is mechanical
Mm-hmm.
restriction. There's nerve tension. So if I have a sciatica case and I can't raise their leg off the table more than 10 degrees uh, due to physical tension, that's real. That's real tension. And if they try to just go do Pilates or this or that, that's probably going to not end well. So it's a combination, and that's where getting the right assessment is essential. Really identifying where a person stands, what is involved, and why did this come on, and why is it persisting?
Do you ever get into talking about someone's belief system
Hmm.
as a factor in some of the pain they might be experiencing? It seems like that would be a big part of certain people's issues. Obviously a mechanical
Hmm.
problem is a mechanical
Yeah.
problem, but
Yeah.
but do you ever get into that stuff? I find that so interesting. It's like,
Oh, yeah. Yeah. And that's, these cases that have had pain for, you know, years. Our average amount of time folks have pain is 3 to 5 years when they're coming in from different parts of the country, and so they definitely have pain behavior. It just they can't not have it. So we're spending a lot of time on pain education and helping peel away the belief that they're damaged. Because often that's what's been layered on. When someone says, "Hey, there's a herniation there," and that's a problem. Especially someone in a white coat in a big institute, that you have to peel that away.
yeah.
So one of our educational talks is that pain does not correlate well to tissue damage. And I think we may have talked about this um,
Yeah.
earlier.
Yeah, it's worth
That
repeating because it's a
Yeah,
really fascinating piece of knowledge that I think people will be very happy to hear.
yeah, and so when you all of a sudden notice you have a bruise on your arm or your leg, clearly there was damage to those tissues if there's a bruise, but you don't remember bumping your arm or your leg. And so pain didn't occur when you had tissue damage. And then even in our country, all the studies on pain, there's thousands, tens of thousands of studies on pain. You can't damage someone in these studies. It's against the rules. That's against ethical guidelines. You can't damage. And so pain does not correlate well to tissue damage. And yet when we have injury, we often get pain. So what does it correlate well to? What does pain correlate well to? Healing. It is there as a protective mechanism to help us heal. So a few months ago, I was playing in a squash game, and I felt something in my elbow. I was playing against some guys that were better than me, but I really wanted to win, so I kept playing, and I won. But the next day, I go to brush my teeth, and I can't get my toothbrush up. My
Oh,
elbow,
ouch.
creates so much pain that I can't bend my elbow. Well, what's going on there? My body is saying, "Hey, don't go past that range of motion. Let that heal."
Hmm.
Protection. It's protecting me to let that heal. Could I have worked through that? Could I have bent my elbow through that? Yes. It would have slowed the healing and not allowed good recovery. But so uh, that's the type of protective mechanism that occurs. 6 to 8 weeks later, I'm functioning, doing just fine. But I might turn and reach behind my seat in the car and feel a little twinge, and that's sometimes that remnant signal of protection that will linger, and often isn't even a true protective mechanism. It's a remnant residual firing of what we
Hmm.
sometimes call neural tags. And so if I said, "Oh, I can't bend my elbow anymore," I could create stiffness again. But if I know that, oh, that's healed, everything's fine, then I can go about my business. And so with that understanding and sort of peeling away, some of this information that's been layered in, people can start moving again. And we'll sometimes try to change their language on on pain and recommend that they call it a signal versus pain, because when they say the word pain, that fires those old memories and emotions that have been layered in over the past 3, 5, 10 years related to that low back pain or the different condition they have. So if we say signal, that creates a new pattern of thinking, and often a logical pattern that's saying, huh, I wonder what my brain is trying to tell me. Is it serious, or is that a remnant?
It's like a signpost, like slow down, maybe is what it's saying, or it depends on what's going on. You know, it's another interesting thing the body does when it's healing is itch. That's a really interesting one. You go, oh, I'm really itching. I've had that particularly after acupuncture. And it's
Yeah,
not
yeah,
because the needle's gone in, it's because there's a healing going on. You go, ooh, that's kind
sure.
of cool.
Yeah, and we'll often folks who've had pain a long time will want to touch their area of pain. They'll want to rub it, and we'll usually tell them, leave that alone. Leave it alone. It's already sensitized. It's like a bruise. And would you want to rub a bruise? No. So leave that, leave it alone. And like an itch, if you if you scratch at something that's it, does it stop itching? No.
No, no, you want to keep scratching it
Yeah.
harder. It's sort of pain pleasure combo there with the itching.
Yeah, yeah.
Starting to
Yeah,
itch
yeah.
right here in my ear as we're talking. But then there's the other aspect of when you hurt yourself, the first thing you do is you touch that area with your hand.
Yeah.
It's like there's a healing part of that. There's energy coming off the palm of your hand. And so that there is that part too. Not to, touch the part where it hurts more, but there is something about, the hands and heat and energy that comes off of them. It's pretty subtle sometimes, most of the time, but that's another piece of it, because even when somebody's working on you physically, as a chiropractor, you're having to touch people. It's really feels so good when another kind of energy comes onto your body in a healing way. It's really it's quite fascinating to me. I mean, it's like there's hardly anything more pleasurable than getting a massage. It's just like the greatest thing.
In our work, we place the high value of the hand in assessment and
Mm-hmm.
in identifying if a tissue, muscle, nerve, fascia has relevant tension or abnormal tension. Practitioner can identify if there is abnormal tension or not, and then that helps really calibrate the true mechanisms that are involved. So often patients say, "How'd you know that was tender? How'd you know that?" Well, and I say, "Well, I palpated a few of these things, and what's and Carol Levitt, one of my mentors from Prague, he often said the hand is the best diagnostic instrument we have. We follow that very strongly, and myself and my other practitioners at the institute, we won't look at any imaging until we've evaluated the patient, because we want to identify in an unbiased way where we feel the problem is before we look at the other technological examinations.
Obviously, there's some technique to that can be taught, and then there's some intuition that humans have for each other and with each other, which is there's knowledge. What I've learned over time is that there's innate knowledge that we have that has gotten a bit lost in the conventional medical world.
100%. One of my other mentors from Prague, I did approximately 15 years studying in Prague with neurologists and physical therapists, and they were just at the Charles University. They're incredible folks, and they're well known in physical medicine and rehabilitation. And I say in a few of my writings how they continue to really evolve the use of their eyes and their hands because they didn't have the means of technology like the Western cultures did, and so it was I was blessed to bump into them and study with them, and One of them was Vladimir Yanda, who's very well known in physical medicine and rehabilitation circles. And he was known for looking across the room and diagnosing someone as they walked across the room. He said, "Oh, there's a hip dysplasia in there," and so fully agree with you on the hands, the value of the hands, also the value of the eyes, uh, and I see a little bit of the appreciation of this coming forward back into medicine. It's slowly coming back. The idea of caring and spending time with the individual. It certainly has been displaced with technology and the rush of seeing folks and payments and things like that. But I see it coming back a bit, and I mean, individuals deserve it. That's where you really will zero in on what an individual needs and what you can provide for them is in that touch. We were, that's that's one of the highest values that you can provide someone is to touch them, give them certainty of that. Hey, I understand this, um, and and together we can move it forward.
You just said something great. I understand this. There is something that is so healing about any situation where you know another person gets what is actually
Mm.
going on. And there's
Yep.
nothing worse than being told, it's all in your head, or it's, I can't figure it out. And, there's nothing wrong, and something's not right.
Mm.
So I understand is a huge part of that. So I'm happy you said that.
Thank you, thank you. Yeah, after our assessments, and at our institute, if you're coming from a long way away, the first day's about 4 to 5 hours that we spend with you, and if you're in town, it's about 2 hours. But when we get completed with things, I usually sit down with the client and say, look, uh, yeah, I just want to let you know what's going on makes sense.
Ah,
And and here's what I think is primarily involved, and we're going to see, how we can change that. And you can just see so often with these folks. Can you imagine if they've been through 8 different practitioners and they've been told usually, well, we've done these injections and you either need surgery or I don't know. They're often full of uncertainty. So I try to provide some certainty in that.
yeah. Boy, just to hear what's going on makes sense. I would think people you'd see their shoulders relax and they might even start to cry, I would imagine.
Yeah, we get some emotional encounters, and it's so rewarding. I tell my team all the time. I walked over there today and told them about this case that had made such a dramatic recovery, and we're so fortunate to do what we do.
And there's case studies in your book. I'm assuming there are. Is that a
Oh yeah, yeah.
there's
There's
yeah. Mm-hmm.
the book is a combination of stories about our clients, stories about professional athletes, stories about things that I've pulled out of movies and other books, uh, and then science. I weave science in there related to pain and behavior and some of the other things that we've discussed, and then again exercises. It's full of exercises to help you move in a direction towards resilience.
Yeah, I think I told you this. I had an issue with my shoulder with some calcium buildup from I think it was a
Hmm.
previous injury. Like I don't remember. So, but I went to physical therapy, and it helped a lot. But the guy said I'm going to give you some exercises. They were incredibly simple. He goes
Hmm.
he goes, but you have to do them. And I go, well, I'm one of the people that will do them, just so you
Yeah,
know.
yeah,
And I
yeah.
did them, and I still do them, and I haven't had that pain in my shoulder since. So
Hmm.
whatever he showed me, it was very, very simple. I mean,
Yeah,
so
yeah.
simple. And I was like, this is, and he was pleased because no one ever, not no one, but a lot of people don't want to do it. They want it done for them. And again, that's accountability.
Yeah. Yeah.
I was looking at your what was sent to me by, I don't know, you or your publicist or whatever you want to call these people. I don't know. The six,
Yeah.
was it six pillars of resiliency? Is that what it was?
Yes. Yeah. Yeah. The
Let's
six
go
pillars.
through that. People need to know. Start counting. Number
Yeah.
one.
Yeah. Yeah. Number one. Well, the first two are genetics and trauma, and those are ones that we're born with the genetics we have, so we can't change that. And then the traumas that have brought us to this point, we can't change that. So those have had their influence, and they're part of who we are. But they contribute, so they're part of the
Mm-hmm.
resilience platform. And then the ones that we can control are how we move or exercise, how we eat or supplement. So that's two of the four that we can control. And then how we treat ourselves, either through self-care or the care that we engage. And that pillar is sometimes confusing. But let's say I strain my knee and I just, okay, rush off and get surgery versus I do a few exercises. Uh, so that treatment approach will affect my pillar of resilience. Okay. And then the fourth one, which is what the one I've found to be most potent over the past 20 years, is the think pillar, or really what encompasses our knowledge and experience that leads to how we respond to things. So, if I'm having, for example, pain, uh, do I go into fight or flight and react, or do I just pause for a moment and ponder? Well, I wonder what I did, and so uh, how we think, as is well established now, affects most things mostly. And so when someone comes to our institute, we do cover all that, break all that down, and often there will be primary pillars for individuals that are different. So someone who's got a lot of inflammation, maybe overweight or obese, wow, we really need to go after their nutrition pillar for them to recover.
Mm-hmm.
Someone who's had pain for 6 to 8 years and it has some anxiety, depression related to that, we're going to have to really spend a lot of time on the thinking side, and hitting all four is going to be beneficial, but we may need to target one versus the other for different folks.
Yeah, there's a chief feature of a pain situation that might be at the top of the pyramid, something like that.
Yeah, and so appreciating those pillars. However, so if someone has a primary emotional aspect, and all you're doing is treating their disc and injecting it, and doing medications, and not addressing that emotional piece and helping them understand what pain is, you can imagine why they're not recovering.
Yeah, yeah, we do a lot to ourselves, don't we? Now,
Yeah.
I want to add one thing that this is from my experience just doing this podcast, is the trauma piece, because it comes up all the time.
Okay. Yeah.
And while you can't change the trauma because it happened, it's a thing that happened, or
Yep.
a series of things, an ongoing situation. But there are some incredibly new and interesting modalities that are not talk therapy, which doesn't seem to work all that well when it comes to dealing with trauma. But there are, a number of I've done a number of episodes on this, from EMDR to accelerated resolution therapy to brain spotting to an actual procedure called the dual sympathetic reset, which is something you kind of
touched on is that when there's a trauma, their actual nerve endings grow. It's a physical manifestation of maybe an emotional trauma, which is really fascinating. And they're able to. It was discovered with an anesthesiologist who discovered that when he was doing anesthetizing people for chronic pain, that it was actually going. Going to the part of the brain which I believe is the amygdala, where trauma is stored, and changing the sympathetic nervous system response. So it's fascinating stuff. I don't know a ton about it other than what I did on those episodes, but I find that that's one of the topics that comes up in almost every other topic. Two things are gut health and trauma. Those are the two biggest things that keep coming up. So I don't think the having trauma is a hopeless fixed thing anymore. It doesn't have to be. I don't know how well each of those things works for who, but I think it's worth exploring. I don't think I think people can take accountability for at least working at maybe finding those solutions to that, because it's pretty severe thing that people walk through life being I hate to use the word victim, but they're a victim of their trauma, and they don't think there's anything they can do about it. And I think that there is. I'm not saying 100%, but it's come up so much that I just wanted to throw that in there.
Well, for sure, and many of our cases have had trauma related to their pain, or there's trauma that's related to their identity, and it is simplistically it is a matter of creating new motor programs, new thought programs to gain more mass in the amygdala, in those areas of thought, to overcome the other. And then when I said simplistically, that it's hard. And that's where my book, I really repeat with how we instruct folks: do these things, juggle, read 30 minutes a day out of a book. You increase your longevity by 20%. But like you said earlier, these simple things, you have to do them. And so someone with some reflexive reactivations, they're going to have to really work hard on these good things on a regular basis. I mean, our diaphragmatic breathing that we teach is very, very simple. But if you do it 15 minutes twice a day, you will change your world. But you can do it. Yeah. And I've seen physiologic change in 78-year-old individuals. And so if you can change their physiology, meaning grow muscle, lose fat, take a degenerative knee and restore it, then you're changing the brain. Recovering from trauma, emotional and physical, is there. There's worlds of evidence on it now. Mindfulness, Ellen Langer, who's been doing this since the 70s, has shown that the brain changes everything. and yet super hard because when I and my team tell folks, hey, do these things and nothing else, they walk outside our door and the rest of the culture says, are you nuts?
Yeah.
What you've got a degenerative knee, you need surgery, or you have to do this or that. So that's part of why it's hard.
Well, thought management is really, a lot of it. But the thing you said, which is I love, is that sometimes you can't start by changing your thoughts by thinking about changing your thoughts. You actually have to do
Mm.
something physical, even
Yes.
if it's pick up a broom and sweep the floor, or take a walk around the block, or pick some flowers and go give them to somebody. I mean, sometimes
Mm.
to me, it does start with some type of an action, and then the thoughts hopefully can follow, and then maybe there's hopefully then you can do other things too. But it does, like those simple things like you're talking about. Sometimes that is the way out of a bad situation.
Sometimes when I'm consulting my resiliency folks, and they're going through some tough times. Uh, uh, they'll I'll hear them talking about themselves and what's going on, and I'll say, well, here's my lesson for today. Uh, Tomorrow, I just want you doing for others. Look, anytime you need to be just do something for someone else, and think about how you can help someone else, and that's related to what you're describing there, and that's the simplicity of the book. Do for others. It's just, again, nothing new under the sun. How selflessness and humility are the primary modes of happiness.
Yeah, it's pretty hard to think about yourself when you're thinking about somebody else. It's impossible to do it
Exactly.
at the same
Yeah,
time.
exactly. Yeah, and it's the same with pain, actually. One uh, little last exercise for you. So pinch your arm
Okay, I'm doing
right
it
now.
right now.
Now
Okay.
pinch your arm
Mm-hmm.
enough where you feel it, enough where you feel it,
Yeah.
and now bite your lip. So
Yeah. Took it over.
you can't feel both at the same time.
No.
And, uh, and that's how all pain goes through the brain. All pain goes through the brain.
Look at me learning something. Clayton, what a great talk, man. Wow. Boy, did I enjoy this. I'm glad the first one didn't, we had the technical problems because I got to talk to you a second time. It's
Oh,
fantastic.
thank you, Bob. Thank you.
Anything else you want the folks to know? Let's say the name of the book and how people can contact you so they can leave with some, ability to further their knowledge.
Yeah, well, thank you again so much. I really appreciate you having me on. And the powerofdoingwhatmatters.com is the site for the book. We also just launched a new educational platform, which will have courses for building resilience and various video and learning formats for expanding your resilience and your understanding of pain and exercise. And that's called curiousgap.com. So curiousgap.com. The curious gap is the gap between what you know and what you do.
Mm.
And it is a curious gap for a lot of us. And I guess my last comments would be the hope that what we're doing and everything we're continuing to learn does help more people know they can contribute to the resiliency. The purpose of my book is so that my daughter, her daughters, and kids and their kids can navigate to these kinds of thinking and care more easily. My hope is that this work helps make that happen.
Well, I really appreciate talking to you today. And folks, you've just found out that there's no such thing as too much Clayton Skaggs. No such thing. Have a fantastic day.
Gosh, thanks, Bob.
Much appreciation for you folks listening to The Exploding Human. The website is theexplodinghuman.com. There's a YouTube channel where you can listen. That is The Exploding Human with Bob Nickman. Once again, I want to thank Clayton Skaggs for being on the show. Check out his website and the new book, The Power of Doing What Matters. Have a fantastic day. Thank you.